Hello everyone, my name is Dr. Andrew Senemes, and today we're going to talk about something that affects millions of people worldwide and that unfortunately often goes completely unnoticed until it's too late: high cholesterol. High cholesterol is a problem because it contributes to clogged arteries, which are the blood vessels responsible for carrying blood to our organs and tissues. When there is an obstruction in these vessels, blood simply cannot flow properly, and oxygen and nutrients fail to reach the cells that desperately need them. When that happens, those cells can eventually die, a process we call necrosis. This is what manifests as a heart attack, which can be a cardiac infarction, an acute myocardial infarction, a cerebral infarction, also known as stroke, or even a renal or limb infarction, essentially in any part of the body where the obstruction has occurred. And this dangerous process happens due to the formation of what we call plaques, a condition known as atherosclerosis. These plaques are deposits that form inside the walls of the arteries, and they're made up of cholesterol macrophages that engulf this cholesterol, calcium, muscle cells, and a fibrous cap on top. As these plaques grow, they can obstruct or significantly hinder the flow of blood. But there's an even more dangerous scenario. Sometimes a plaque can detach, attract platelets, form a clot, break off, and travel through the bloodstream, causing a heart attack, an embolism, or a stroke in another part of the body. This is precisely why it is so important to keep our blood cholesterol levels within the appropriate range. Now, what symptoms and signs might indicate that we have high cholesterol? Given everything I just mentioned, you'd think our bodies would give us some kind of a warning signal. And here's where things get really concerning. High cholesterol is almost entirely asymptomatic. I have personally seen patients with stratospheric cholesterol levels, figures of 2,000 or even 3,000 milligrams per deciliter, who felt completely fine and showed absolutely no symptoms at all. The tragic reality is that in many cases, the first symptom is the cardiovascular event itself. A heart attack, a stroke, a cerebral hemorrhage, or the discovery of a blocked artery in the legs, the intestine, or the kidneys. You find out at the very moment it happens. And that said, there are, some physical signs that can appear in people who have had high cholesterol for a long time, and it's worth knowing about them. The first are xanthelasmas. These are yellowish plaques that appear on the inner corners of the eyelids. They are strongly associated with high cholesterol levels, although in some cases a person with xanthelasmas may have normal cholesterol, so they are not diagnostic on their own, but they are highly suspicious, especially in people under 40 years of age. Then there are xanthomas, which are fat accumulations under the skin that appear as flat, yellowish or orange, slightly raised deposits. They can show up on the Achilles tendon at the back of the ankles, on the knees, elbows, and on the back of the hands, particularly at the knuckle level. And these are also highly suggestive of elevated cholesterol. And finally, there is the corneal arc, a whitish ring that appears at the outer edge of the iris, either partially or completely. This is also a strong indicator of hypercholesterolemia, particularly in people under 45 years of age. I'm frequently asked by patients whether fatigue, dizziness, headaches, constipation, abdominal discomfort after eating, blurred vision, or other general symptoms are related to high cholesterol. And the answer is not directly. Some of these symptoms could theoretically appear when very high cholesterol has been present for a long time and ischemia begins to occur, meaning a lack of adequate blood supply to a specific tissue. But even then, they tend to be very specific and can be caused by a wide range of other conditions. So in terms of cholesterol alone, as I said, there are people I've seen with extremely high levels and no symptoms whatsoever. Let's take a step back and ask a fundamental question. What is cholesterol and why do we even have it in our bodies? Cholesterol is actually essential to life. It is absorbed through our diet and reaches the liver, which metabolizes and transforms it into substances called lipoproteins. Proteins bound to cholesterol, and sometimes also to triglycerides that transport cholesterol to the rest of the body. Cholesterol plays critical roles. It forms cell membranes. It is used to produce certain hormones such as adrenal hormones and sex hormones, and it is needed for the production of bile acids, which travel to the intestine and help us digest fats. So having cholesterol is not a problem, and the problem is having too much of it. Now, you've probably heard that there are two types of cholesterol. In reality, there is only one cholesterol molecule. The difference lies in how it is transported. When the liver processes cholesterol and releases it into the bloodstream, it does so in the form of two types of lipoproteins, LDL cholesterol and HDL cholesterol. LDL stands for low density lipoprotein, and this is the one that carries cholesterol out to the tissues. It is also the one responsible for contributing to the buildup of atheroma plaques, which is why it's commonly called bad cholesterol. HDL, on the other hand, stands for high density lipoprotein. This one travels in the opposite direction, picking up cholesterol from the tissues and organs and carrying it back to the liver. And it can even partially remove cholesterol from existing plaques, which is why it's called good cholesterol. The goal, therefore, is not just to measure total cholesterol, but to look at the ratio between LDL and HDL, always aiming to lower the bad and raise the good. So what are in the normal cholesterol levels? The guidelines can vary slightly, but as a general reference, LDL cholesterol, the bad one, should ideally be below 100 milligrams per deciliter in people without cardiovascular risk factors. Between 100 and 129 is considered slightly elevated, and 130 milligrams per deciliter or above is considered hypercholesterolemia, genuinely high cholesterol. When we look at total cholesterol, below 200 is considered normal, between 200 and 249 is borderline high, and 250 or above is hypercholesterolemia. And these figures apply to healthy people, those without risk factors such as hypertension, smoking, obesity, diabetes, or prior cardiovascular disease. In people with high cardiovascular risk due to existing conditions or a significant accumulation of risk factors, the target LDL level may need to be below 70 milligrams per deciliter or even below 55 milligrams per deciliter. Mm-hmm. In other words, the more risk factors you have, the lower your cholesterol target needs to be. What causes high cholesterol? Genetics can certainly play a role. In some extreme cases, there are inherited genetic diseases that cause very high cholesterol levels. And these can even lead to heart attacks in children, which, while rare, does happen. But the most common cause by far is lifestyle. A diet high in unhealthy fats and refined sugars, a sedentary lifestyle, overweight and obesity, these are the main drivers for most people. There are also medical conditions that can secondarily raise cholesterol, including diabetes, hypothyroidism, kidney disease, HIV/AIDS, polycystic ovarian syndrome, and lupus. And certain medications can also contribute to elevated cholesterol, such as thiazide diuretics used to treat high blood pressure, drugs used for acne, cancer chemotherapy agents, immunosuppressants used after organ transplants, and some HIV medications. All of this must be taken into account when evaluating a patient with high cholesterol. So how do you find out whether your cholesterol is high? The only way is through a blood test. As family physicians, we routinely include cholesterol testing in standard checkups, and it is also commonly ordered during occupational health evaluations. It's simple. A routine blood draw tells you everything you need to know. Of course, monitoring needs to be more frequent and more careful if you have cardiovascular risk factors. If you're hypertensive, if you smoke, if you have a family history of early heart attacks or genetic cholesterol disorders, or if you've already had a cardiovascular event such as a heart attack, stroke, or peripheral vascular disease. If your blood test does come back showing high cholesterol, the first line of treatment is almost always a change in lifestyle. That means following a balanced diet with reduced fat intake, paying close attention to the types of food you consume, eliminating tobacco, reducing or eliminating alcohol consumption, getting regular physical activity, and managing any other underlying medical conditions you may have. And these lifestyle changes are the foundation. If they are not sufficient, particularly when cholesterol levels are very high, it may be necessary to add medication such as statins to bring those levels under control. So the message I want to leave you with is this: high cholesterol is silent, but it is not harmless. Don't wait for symptoms that may never come. Get your blood tested, know your numbers, and take action early. Thank you very much for watching. Take care of yourselves, and I'll see you in the next video. Sonnet 4.6. Claude is AI and can make mistakes. Please double check responses.